Welcome to Prescribed by Dr. Nathan Goodyear, where integrative oncology meets holistic healing. This podcast is your home for the latest in innovation, exploration, and elevation in all areas of integrative oncology, medicine, health, wellness, and beyond. Join me and a host of other innovators as we go from practicing to prescribing. Your daily dose of wellness begins now. Welcome back to another hot take by Dr. Nathan Goodyear. Vitamin C arms T cells and amplifies immune checkpoint inhibiting therapy. If you know anything about my writing and my talks and lectures, I talk a lot about vitamin C. There's certain therapies in the integrative oncology world that are flagships. They draw attention from both sides. There's vitamin C delivered IV, high dose, but then there's also repurposed medication. So I talk a lot about those, and I talk about the science because they are at critical pivot points between a more natural holistic approach and a conventional cancer approach, what many would call traditional, but I call conventional. And the bridge there is integrative medicine. Now, it's really interesting when you look at high-dose vitamin C because it augments these immune checkpoint inhibiting therapies, particularly here, what's called programmed death 1. Now, it's been shown that as vitamin C, it's been shown to improve the efficacy of immune checkpoint inhibitors as, again, programmed death 1, but also it does it by modulating the tumor microenvironment and boosting the anti-tumor immune response. So let me give you some quick takes here of how it does it, and we'll discuss each one in depth. It inhibits the PD-1 expression. We'll come back to that. It enhances cytotoxic T, that's CD8 cytotoxicity. It activates, it increases the antigen presentation of cells to the rest of the immune system. It modulates the immune-related signaling pathways, and it epigenetically reprograms cells and signaling. So let's go through each one of these to highlight how vitamin C basically augments immune therapy, here immune checkpoint inhibiting therapies. Then we'll get right to the specifics of the vitamin C and the PD-1. Vitamin C inhibits PD-L1 expression. Now, I mentioned PD-1, that's programmed death 1, which is expressed on T cells, and then programmed death ligand 1, which is typically expressed on tumor cells. Now, when you think about these ligands, programmed death ligand, you go, wait a second, what is this? Well, it's an immune checkpoint. It's a regulation point. So think about it this way. If the immune system is going around and attacking itself, that is the body, that's not good. So the creator put in these regulatory points that go, whoa, checkpoint. Don't attack me, I'm you. It's this recognition of self versus non-self. So this ligand can be expressed on a cell. The immune cell will come along and go, oh, that's me, move on. Now, cancer doesn't create anything new, but it disrupts everything that's there. It's a great adulterator. And so what it does is it'll take advantage of that and go, well, I can make use of that. And it expresses that programmed death ligand. The T cell comes along with the programmed death receptor, and it sees it, and it just moves on. So that basically acts like go back to the Star Trek days, a Klingon cloaking device. And so the immune system just simply doesn't see it. It hides from the immune system. It evades. What vitamin C does is it downregulates the expression of programmed death ligand 1, PD-L1, on the tumor cells. And this diminishes the tumor's ability to evade that immune response, that immune detection, what's also called immunosurveillance. And what this does is this enhances T cell mediated immune response, which is what we're after in trying to trigger an immune response as it relates to cancer. Second, it enhances cytotoxic T lymphocytes. It increases the infiltration and activation of CD8 T cells within the tumor microenvironment. And this is going to, of course, increase in tumor destruction. 3, it activates, it increases antigen presentation. So the combination of high-dose vitamin C and programmed death 1 inhibitors increases infiltration and activation of macrophages and increases phagocytosis. And then what you're going to get is you're going to get the processing of these dead pieces of cancer cells, and you're going to present them to the rest of the immune system to then activate the immune system. Remember, our best friend and ally in the fight against cancer is the immune system, because after all, the immune system's job is to protect the body against all enemies, foreign and domestic. It modulates the immune-related signaling pathways, so it upregulates pathways involving B cells, T cells, increasing memory immune cells of B and T cells so that they go around and they remember as they look for other cells. It also increases phagocytosis. I mentioned this as it relates to the macrophages and the antigen-presenting cells just a second ago. And it increases the activation of natural killer cells. Now, these cells are very interesting. Natural killer cells, their name implies exactly what they do. They naturally kill. They just have to be directed what to do somewhat. Now, medicine doesn't typically name things in a way that makes common sense, and we'll get to that in just a point. But natural killer cells is one thing that they did quite well. And finally, epigenetic reprogramming. I've talked a lot about epigenetics and genetics, or genomics and epigenomics. Genomics is looking at the DNA, the set of DNA, which doesn't change, but how it's expressed does. That is above genetics. That's epigenetics. So high-dose vitamin C induces genomic-wide methylation, demethylation. And this reprogramming enhances the cytotoxic, that cell destructive activity of cancer cells by T cells. And so thus it improves the anti-tumor immune recognition and immune response. Now, when we look at the high-dose vitamin C and the program DEath-1 and immune checkpoint inhibitors here, we have to understand that almost all this data is preclinical, meaning it's non-human, it's in animals, or in vitro, which is like in a petri dish. But here it's animal, and we can look at lung cancer models of mice in non-small cell lung cancer, combination of high-dose vitamin C and program DEath-1 significantly reducing tumor growth compared to other treatments alone. The combination increased cytotoxic, again, CD8 T cell infiltration and granzyme B production, which basically increases natural killer cells and cytotoxic T cell activity. And then also a lymphoma model where high-dose vitamin C synergized again with PD-1 blockade to inhibit tumor growth. So these are preclinical. They're mouse, but not human. And it's important to understand the positive of research, but also the limitations of research as well, because science is not a de facto, all the science is known. As you've heard me say, that is by nature unscientific. So let's get to the PD-1 inhibitors. Just a side note here, nivolumab and pembrolizumab. These are two well-known PD-1 inhibitors. Now, here's a perfect example of whoever comes up with the name of these drugs should be tarred and feathered. Nivolumab and pembrolizumab, goodness gracious, it's not like it just flows off the tongue. These PD-1 inhibitors, they block the PD-1 receptor on the T cells, thus enabling the immune system to be able to see the tumor cells. Normally, when the tumor cells express the PD-L1, it binds to the PD-1 on the T cell receptors, and this inhibits that immune recognition, immune surveillance, which is key in allowing the cancer cells to evade the immune system. So let's step back a little bit, because we have to recognize when we talk about cancer, people say, well, the key step in cancer is when it invades and when it's growing. Well, yes, but the most important fact about cancer, the almost rate limiting step, if you will, is when it evades the immune system. Because when it invades the immune system, then that's the bridge that allows it to move from something that's really kind of a local process to one that then can move throughout the body systemically. And that's important, because when cancer spreads systemically, that's the cause of 90% of morbidity and mortality in cancer. Let's think about this. Then if high-dose vitamin C normally decreases PD-L1 expression, then does that not counter the effect of immune checkpoint inhibiting cells? See, less PD-L1 expression means less need for PD-1 inhibitors, okay? Nivolumab and pembrolizumab. That's what you might think on the surface, because we think, well, it may be less effective. But when we look at this, it actually complements the PD-1 inhibitor. See, vitamin C downregulates PD-L1 expression on the cancer cells. And then the nivolumab and pembrolizumab, because of the downregulation of the PD-1, those act as a PD-1 inhibitor, then the two together, though they're working in different space, they actually complement each other and they actually improve immune activation. So let me go through this and how this does this. The partial PD-L1 downregulation with the high-dose vitamin C, it doesn't eliminate that ligand altogether. And so then in turn, what it does, it is actually increasing the sensitization of the immune system to the tumor antigen. So by not completely blocking out or inhibiting programmed death ligand expression at all, it actually increases the sensitization because there's less of it, but it improves the immune response to it. The PD-1 inhibitors then further block the PD-1 PD-L1 interaction. So we increase sensitization, then we add in the PD-1 inhibitors, nivolumab and pembrolizumab. And now what we have is a synergistic relationship where we get improved immune surveillance, improved immune activation, and then local destruction. That's what synergy is. Synergy is not additive. Additive is 1 plus 1 equals 2. Synergy is 1 plus 1 equals 10. Here it's 1 plus 1 equals 100. Now, vitamin C also reshapes the tumor microenvironment. So it's not just having an impact on the PD-L1 expression here. It's going to increase T cell infiltration, T cell activation, natural killer cell infiltration, activation. So it's improving the immune environment within the tumor microenvironment, which there's many different niches, N-I-C-H-E, in that tumor microenvironment. And the immune system is a big part of that. Vitamin C also, high dose, reduces the immunosuppression. Again, a lot of discussion around the immune system when we talk about cancer. People think, well, I'm increasing the immune activity. By increasing the immune activity, that's not always good. It can be bad. If you increase T cells that are T regulating cells, that's actually immunosuppressive. But if you increase cytotoxic T lymphocytes, and thus we have a ratio that favors the cytotoxic T lymphocyte CD8 cells less with the immunosuppressive T regulating cells, you're going to get a balance that turns the immune system on the cancer. But in the flip side, if you get a high immunosuppressive T regulating cells, a lower CD8 cytotoxic T lymphocytes, you're going to get an immunosuppressive and allow the cancer to evade the immune system. It's really a anti-tumor versus pro-tumor, but simply there within the immune activation, immune stimulation. But again, it can go one way or the other. So by affecting the immune cell infiltration, activation, and reducing immunosuppression, vitamin C, beyond just the immune checkpoints, is actually improving the immune environment, immune signaling to favor one that is anti-tumor, not pro-tumor. And so when we look at these, we see that these are synergistic. My take on this is, though this is preclinical, we know how safe vitamin C is when properly administered in the hands of doctors properly trained. What you're going to see is you're going to actually see a synergistic effect. So here it's a win-win, because not only does it improve the immune checkpoint inhibiting therapies, but it also is going to reduce the side effects. And the vitamin C itself tends to have very, very low side effect profiles as well. So it's a win, it's a win, it's a win. But we got to help conventional oncology to understand how these work together. Look at the science, look at the research, because the way most of them look at vitamin C now, honestly, I truly believe this, they think it's orange juice. Ovaltine, vitamin C. I mean, I think that's what they think. And they don't see any difference between oral vitamin C and IV vitamin C. Though research has very clearly shown that oral vitamin C is antioxidative, high dose IV vitamin C is pro-oxidative. Completely different because of the modality of delivery, primarily driven by pharmacokinetic principles. I mean, that goes back to Linus Pauling and Ewan Cameron in 1976, 1978, where they gave IV vitamin C. They gave 10 grams to terminal cancer patients and saw prolongation overall survival. Then 3 doctors that collectively called the Mayo studies came in and said, well, I'm going to get 10 grams, but I'm going to give it orally. And they saw no benefit. Well, that's because of the different in pharmacokinetics, liberation, absorption, distribution, metabolism, and excretion. These are basic pharmacology principles that differentiate IV from oral delivery, which we now know. So what about delivery? Is there a timing of high-dose vitamin C in conjunction with the immune checkpoint inhibiting therapy here, particularly the PD-1 inhibitors? Yes. These animal studies have shown they're either sequential or together. Sequential being vitamin C first, followed by the PD-1 inhibitor, or our preference at the Williams Cancer Institute, when we inject it into the tumor, we give them together. We give them together. See, I think we also have to understand that cancer is not sitting there doing things in a sequential manner. You know, like the way we approach conventional cancer: surgery, chemo, radiation, as if cancer is going, oh shoot, they did surgery and I never saw chemo coming. We got to start thinking exponentially, because that's the way cancer's working. The way conventional cancer care approaches cancer treatment, it's like it's 1D, but cancer is on a different level. It's not even 3D, it's 4D. It's just working in a different stratosphere than we are thinking, because I think we're limiting our thinking. Another conversation for another day. So sequentially, vitamin C right before PD-1 inhibitors, or I think, and the research supports together is probably the best. And of course, we do that intratumorally. Understand that PD-L1 is not the only immune checkpoint inhibitor that allows cancer to evade the immune system. There's many other immune checkpoints that can be utilized by cancer to escape the immune system. Now, the PD-L1 and PD-1 inhibitors are the most prominently researched, and when you look at vitamin C equally, it's the most prominently researched. So I think time will tell that whether vitamin C will have a broader immune checkpoint benefit, but I do believe that it will show the same benefit that we find in the nivolumab and the pembrolizumab. See, I can't even say it. Tar and feather. Let's come up with a better name, guys. Come on. I think time's going to show that the vitamin C high dose here is going to have the same effect across the immune checkpoint inhibiting therapies, because it's modulating the immune environment. It's prepping the immune system. It's reducing the immune suppression. It's improving immune surveillance, all of which is further going to help when you add immune checkpoint inhibiting therapy to just simply work better. And then it reduces side effects. It improves quality of life. Again, you start stacking win after win after win after win. It's the beauty of synergy, but it's the beauty of stacking an integrative therapy like high-dose IV vitamin C with immune checkpoint inhibiting therapy, which is a conventional cancer care. That's the end of this hot take. That's vitamin C with immune checkpoint inhibiting therapies. I'll see you on the next hot take with Dr. Nathan Goodyear. Thanks for joining us on this episode of the Prescribe Podcast. All references supporting this episode can be found on the prescribe.com website. That's pre-scribe.com. To get your next dose of medical innovation, make sure you subscribe to Prescribe. We'll see you for your next refill.